Hi, my name is Tara, and I'm the Social Impact Coordinator at Unite for Sight. I'm going to tell you a little bit about the Social Enterprise Pitch session at the Global Health and Innovation Conference. This session is a unique opportunity for speakers to present their idea in the format of a 5-minute pitch. All presentation are ideas that are currently in development, meaning that they are in the early implementation or brainstorming phase. Following each presenter's 5-minute pitch will be a 5-minute session of question and answers with the audience. This format provides our presenters with the opportunity to formulate their idea, collaborate with others who are interested in their idea, and receive feedback and ideas from the audience. The goal is a dynamic session in which the speakers and the participants will collaborate about the ideas presented, and the goal is that these ideas will be successfully implemented in the future. Submit your abstract at the time that you register. On the online registration page, there will be a submission form for you to submit your abstract, as well as a brief biography. Your abstract should be no longer than 250 words, and longer submissions will not be reviewed. Your submission will be evaluated based on the level of innovation, the expected impact, as well as details indicating that it is evidence-based. Lastly, your pitch cannot be planned as part of an existing organization. In your abstract, you should be sure to include 7 main topics. First, begin by describing the problem that you are trying to solve. Second, what is your solution and why is it important? Third, how is your idea new and what about it makes it an innovative proposal? Fourth, discuss the evidence base behind your intervention. In other words, why will it work? The 5th area to address is impact. What are your outcomes and what metrics will you use? There is an important difference between outputs and outcomes, and it's important that you discuss outcomes. For example, an output would be the number of individuals enrolled in a job training program. This isn't particularly important, however, if none of those enrolled actually end up getting a job. Therefore, the more important indicator is an outcome, which would be the number of individuals who actually get a job. Another important thing to discuss is causality. For example, how do you know that those who end up getting a job did so because of the job training program? Therefore, in your abstract, it's important to talk about outcomes, outputs, and methods of measurement. Next, comment on the management and financing of the intervention. Who will lead the social enterprise and what are the anticipated sources of funding? Lastly, comment on the stage of the proposal. Are you in the early implementation or brainstorming phase, and how much progress has been made? In developing your presentation, you should be sure to include the 7 main topics that you mentioned in your abstract. While you are creating and practicing your presentation, you should consider what you hope to learn from the experience. What obstacles and plans are you currently working through, and what kinds of individuals do you hope to connect with at the conference? The answers to these questions will help you to emphasize certain parts of your presentation and perhaps de-emphasize other parts. The most effective presentations will explain the idea in a way that is immediately understood by the audience. By the end of the presentation, the audience should understand why the idea is important, how it will be implemented, and what the impact will be. In general, it is best to avoid the use of jargon or abstract ideas. Instead, you should use concrete examples and real-life stories to illustrate your plan. The following is an example of a powerful and effective presentation that was done at the 2010 Global Health and Innovation Conference.
Good morning. If you're at a conference on public health, you're ahead of the game. You understand that if medical science isn't affordable to real people, then medicine is impotent. I learned this the hard way. I worked in an endocrine lab where we abandoned a diagnostic discovery that could have saved millions of lives because, and I will never forget these words, there is no money in preventative medicine. That sounded ridiculous to me, but it's true. There's more money to be made improving bubblegum in this country than preventing Addison's disease. So when we talk about America's healthcare crisis, in my opinion, we're not talking about a failure of our medicine or a failure of our science. We're talking about a failure of our market. I spent time in business wondering very often, is there, if this is a market-based problem, is there a market-based way to help improve the problems that we here all know so well? Where are the carbon credits of medicine? So in October, I decided to start a company focused on, perhaps a very rational decision, I quit my job. I decided to start a company focused on the health insurance cartel, which, if you had to pick a sector in the supply chain that is most directly causing all of the other problems, right, as we've now heard, this would be it. And my solution is actually quite simple, although people tell me it's a little ridiculous. I want to let investors directly underwrite, price, and own health insurance risk without HMO middlemen. Now, why would that matter? Why would that possibly be a good idea? Well, what I've heard all weekend and what I hear in general in public health is that when we talk about what's wrong with healthcare, we're talking about three problems: cost, social equity, and health outcomes. I think our approach is a way to dramatically impact all of these, not just for health insurance, but ultimately the entire way that all of us price, think about, and use our medicine in this country this decade. Cost is the most obvious. Though it's also a political issue, the most time-honored way to fix any broken industry is new competition. Today, institutional investors are very frustrated by very overvalued investments in stock markets and bond markets and commodities, while the HMO cartel's stranglehold has grown so strong this decade that we estimate, and I have a little bit of this slide here, it's not much, that they earn an average of 21% annually on these policies. 21%.
As you can see, Sahil's presentation was done in an engaging format that grabbed the audience's attention. He didn't rely on his PowerPoint, but instead used examples to make his pitch clear and concise. While you will have 5 minutes to make your pitch, the more succinctly you are able to explain your idea, the better. It's therefore important that you practice your presentation beforehand to make sure it's not over 5 minutes. After 5 minutes, a bell will ring, indicating that your presentation is over and that there will be a 5 minute of question and answers. So good luck, we hope to see you at the conference, and feel free to contact us if you have any questions.